IMAT. It stands for
Integrated
Medication
Assisted Treatment. Saludos, my name is Alex Perez and I am the lead BHRS specialist for the IMAT team. My pronouns are she, her, and ella. I'm really excited to bring forth this video about our team. So IMAT stands for Integrated Medication Assisted Treatment. Pretty much what that is medication that can help somebody safely come off of either alcohol or opiates. A lot of people, they don't know that there's medicine out there that could safely help an individual come off of substance use for either alcohol or opioids. And so what our team does is we help get patients connected to those treatments. A lot of people, they don't know that there's medicine out there that could safely help an individual come off of substance use for either alcohol or opioids. And so what our team does is we help get patients connected to those treatments. So a big part of what we do is accessibility. And so that accessibility goes straight into marginalized groups. Something to understand about our team is that we come from a very non-judgmental perspective, meaning anybody can kind of pick up where they left off as far as their recovery goes. We are very accepting of the population. We make sure that there is actually no room for judgment when it comes to services. And so the way that we have been able to do that is not only by incorporating different languages, incorporating different practices within recovery, but we also remove a lot of those barriers and we remove a lot of stigma. Something that is very prevalent within this field is the stigma of substance use. And so what our team does every day is try to remove that stigma from everything that we do. So I would say within the past year, 2024 was a very big year for us. The reason why is because going into that topic of accessibility, we really wanted to make sure that we were giving the public what they desired. And what they desired was more outreach, was more education, especially with dealing with the fentanyl crisis, making sure that marginalized populations have access to the same information as anybody else would. We did this by collaborating with community partners. We did this by collaborating with providers, making sure that they understood that there was a service and that there is a service for medication-assisted treatment where they could connect patients to these types of treatment. Not only that, but we did a lot of outreach presentations. We recently, took on board a community health planner that has been doing a spectacular job when it comes to not only forming bonds with the community, but making sure that everybody has access to life-saving medications such as naloxone. So we have been able to distribute naloxone. We have been able to make sure that communities of color have access to education around substance use disorders and the dangers that we are finding within these present times. I think one thing to really note is the fact that within this field, it is constantly changing. So from the medication side, there are constantly new mechanisms, new medications that are constantly in works to make sure that we are giving options for those who want to change their relationship with substance use. I think on our side as, case managers, it's really cool because we get to adapt to not only the innovation piece, but we also get to adapt to what the needs of the community are. For example, I would say that within the past year, we've really seen an increase in the amount of Spanish-speaking referrals. And so one thing that we did in 2024 is to translate all of our documents into Spanish. We also incorporated Spanish-speaking presentations to the community. We are going out to not only San Mateo, but we are also going out to the coast. We're also going up north to Daly City, down south to East Palo Alto. And so I think one thing that really just sets IMAT different from a lot of teams is the fact that we are constantly trying to better ourselves, making sure that accessibility is a top priority for our team, and making sure that the needs of the community are reflected into the work that we do every day.
My name is Mark Ross. I'm a lead BHRS specialist with the IMAT team, and my pronouns are he, him, his. So the IMAT team started with a pilot. I came in a couple years later, but from my understanding of the pilot, they had great success with reducing emergency room visits and with increasing outpatient treatment. And so that's always been the goal of the team, is to reduce the amount of crisis and emergency and link people to more support and outside services in the community. So in the beginning, the team focused on alcohol use disorder and the medications that helped with cravings, including the naltrexone and the Vivitrol, which is the injectable form of naltrexone. And they saw a lot of success in those areas. As time progressed, the fentanyl crisis began to bloom, and opioids became a big problem that spread from the cities and worked their way into San Mateo County. And so what we had to do is evolve and adapt. And initially the system didn't think that we really needed to address the opioid epidemic in this area. And we were able to convince them that we did, and we were able to work with the providers at San Mateo Medical Center and the providers at the Health Right 360 San Mateo Clinic to provide buprenorphine treatment, Suboxone treatment for people with opioid use disorders. So when we do interact with patients at the emergency department, a lot of times they're coming in and they haven't had their needs met in a lot of different areas, and they're uncomfortable. So a lot of the little things that we do can be really big in terms of value and just making that person's day a little better. We might give them a sandwich or some juice, ask them if they need some water. Sometimes their clothing is soiled, or if it's raining outside, they're soaking wet. We have ponchos, we have sweatpants, we have socks, we have hygiene kits. And one of the main things that I've found with our opioid using patients is they'll get a prescription for Narcan for reversing overdose. They're not going to pick up that prescription. And so a lot of times we just hand them a box.
So we wanted to share just a little bit about where we're located. Throughout the years, as Mark stated, we were primarily based at San Mateo Medical Center. But as the years went on, we really saw the need to expand to the community. We since then have expanded to, the jails, McGuire and Maple. We've also expanded to the Navigation Center in Redwood City. I think we saw the need to really make sure that accessibility was highlighted when it comes to accessing services. And so those places in particular, we saw that more clients were interested in getting connected to medication-assisted treatment. I think with our expansion, our team really saw just the need for 2 case managers. And so the beauty about having 2 individuals that can support a team is the fact that Mark and I, have a common vision, but we're also really different as well. And I think that we are definitely the yin and the yang. And so when it comes to client services, we are very much alike. When it comes to the outreach and education, maybe that would be more me. When it comes to just protocol in the emergency department, that would be more Mark. And so I think the beauty about just having 2 team leads is the fact that we can really tend to our team, but also share different ideas on how to collaborate, how to expand, and how do we make sure that all clients are being served under IMAT. On to our colleagues, Gabriel and Todd, who will elaborate more about the tremendous work that they do in the community and at the Navigation Center.
Yes, indeed. Those guys, they help us out a lot. And oh no.
Getting a call.
Hi, my name is Todd Henderson. I'm a case manager assigned to the Navigation Center, he, him pronouns. So our team, we provide quality, client-centered, trauma-informed care. And I think it starts with that. Once folks are introduced to the medications, the medications by themselves is not enough to keep somebody clean and sober. Integrating the medications in along with some other form of treatment, whether that be outpatient treatment, residential treatment, if somebody wants to do virtual services, all of those things kind of help. And then in addition to the case management support, one element of our role is to provide recovery support. So meeting our clients where they're at and providing help and assistance curtailed to whatever their current situation that they're going through. We just had our first successful client that was housed from the Navigation Center. We intervened because when this client did their CES assessment, they were scored incorrectly because they had answered the questions based on, if they ask questions around substance abuse, of course the person's going to say, no, I don't use substances anymore. So we had to go back and have that client reassessed. And when he was reassessed, about 2 weeks later, he was housed. Well, medication-assisted treatment makes our community safer because, folks can't overdose on fentanyl if they have Suboxone on board. So definitely makes the community safer. We offer classes on housing, medication-assisted treatment, STDs, HIV, and we have the WET team come out and do a presentation. It's a collaborative effort. So all of our case managers get involved and they come and teach some of the classes or facilitate some of the classes, which is great. At the Navigation Center, we do a lot of that, whether it's communicating with the staff at HIA, Healthcare in Action, or the staff at El Centro, the staff at Life Moves. Like, we're all collaboratively working together and helping an individual succeed.
I'm thinking about team culture, and I think one of the things within this video that would be cool to see would be just how how goofy this team is, and just the warmthness that we bring and how it really trickles down to clients.
That's what I love about this team. This work can be heavy, really heavy. Taking care of each other, taking care of ourselves, getting enough self-care in, and getting out in with nature and amongst the trees and the birds and the lakes and stuff like that. It's huge. It's a unique team dynamic because we all pay attention to how each other's feeling, how each other's performing, how each other's, what they're going through, and offer support. So it's pretty cool that way.
I think when it comes to just overall trust, it's felt when you are moving forward with services. And so I think the trust that we have within our team is definitely felt within the community and is very much echoed with the types of service and how we move forward with services and practices.
If I need a suggestion or a tip or want to consult with a case manager on a specific case, I wouldn't choose any other team to do it with. We are a good team. We're a really good team.
T stands for... Sorry.
No worries. Pick up whenever you're ready.
Put that in the video.
Hi, my name is Mark Ross. I'm a lead BHRS specialist with the IMAT team. My pronouns are he, him, his. Go. Did that go okay?
Yeah.
Oh, okay.
You can redo it if you'd like, but
I feel like I said he, him, his.
Because you were like.
I was like, I felt like I was missing something. All right. Okay.